Medical Group.
Colorectal cancer is the second leading cause of cancer-related deaths in the United States when both sexes are combined. It's expected to cause more than 49,000 deaths this year. Fortunately, the disease is not only highly beatable and treatable, but also highly preventable. For years, Spectrum Health has been a leader in advocating for colorectal cancer awareness and regular screening. They're proud to host the 33rd annual Irish Jig 5K race coming up later this month to promote colorectal cancer awareness. And here to talk about all of that, Dr. Heather Slay, a colon and rectal surgeon, and Kelsey Haynes, Irish Jig race director, both from Spectrum Health. Good morning. Welcome to both of you.
Good morning.
We want to talk about the event in just a minute, but let's talk first a bit about colorectal cancer and the importance of screening. First of all, are there certain people or lifestyles or risk factors that people should be aware of?
Sure. Well, everyone is at risk. The average lifetime risk is 5% for the average person that will develop colon cancer. But there are people that are at a certain increased risk, those with a family history of colon cancer or colon polyps, those with a personal history of breast, uterine, or ovarian cancer, patients with a long history of inflammatory bowel disease, ulcerative colitis or Crohn's disease. And then, like many cancers, there are certain lifestyle modifications that will make a difference. Avoid smoking, alcohol only in moderation, eat a diet that's high in fruits and vegetables, low in high-fat foods like red meat, exercise, those types of things.
I know this is a cancer that doesn't really present itself in dramatic ways in the early going, but that there are some symptoms that may come along later. Tell me about some of those.
Well, the majority, cancers often start as polyps and is generally a slow-growing cancer, colorectal cancer is. So many patients are without symptoms. When patients do develop symptoms, they may develop rectal bleeding, blood in the stools, abdominal pain, change in bowel habits, either change in caliber of the stools, diarrhea, constipation, weakness, fatigue, things like that. But it can be a silent disease for many years.
So enter the importance of the colonoscopy, right?
Correct.
When is that screening supposed to take place for the first time?
So the average risk patient, so that's a patient without a family history, the recommendation is to start screening at age 50 for both men and women. So a screening colonoscopy is really the gold standard. And in that way, we can detect polyps before they turn into cancer, thereby preventing colorectal disease.
These are just little things that grow in the colon, and you can identify those in an early stage and get those out of there so they don't turn into something worse.
Absolutely. They're small little growths in the lining of the colon or the rectum that can be removed when they're quite small.
And so, but treatment, like let's say something is found that needs treatment, what's happening in that regard?
Usually the treatment involves surgery. And then chemotherapy and or radiation may be recommended either before or after surgery, depending on the stage. It's highly dependent on the stage.
Yeah. All right, let's talk quickly about the Irish Jig, because this is fun. This has quickly grown into a great big 5K.
Yes.
And people want to do it. It's March 19th.
Yes, March 19th, 9 a.m. It's in East Grand Rapids. We're really excited for this year. Again, it's the 33rd year. It supports colorectal cancer prevention. We have a couple of new things this year, so we're really excited. We have a gear check, so we've not had that in previous years, so runners can actually check their belongings while they're running for free. We'll have a vehicle outside of Derby Station there, so we're real excited about the Irish Jig. We also will have, again this year, backed by popular demand, the photo booth inside, so people can don Irish Jig themed items and have their photos taken and take them home with them.
All right, again, that is March 19th. If you'd like to register or learn more about colorectal cancer, go to our website, wzzm13.com. Under the exchange, you can find all the information there. Good to have you here. Thanks for watching.